You know, like so many of my colleagues, Madam President, I've spent a lot of time these last few months reaching out to my constituents, my fellow citizens in Louisiana, in every part of the state. In the August recess, obviously there were lots of town hall meetings around the nation. I held 21 in Louisiana in every corner of the state. Since then, I've held 6 more town hall meetings. I continue to do other types of I've heard certain themes over and over again, no matter where I was in Louisiana. One of those themes was great concern about what this Congress is thinking of doing on health care, but not just because of the significance of health care, which is vitally important, which is personal to every American, but also because of how it fits into a trend so many Louisianians and so many Americans are seeing over the past year, a trend of dramatically increasing federal government power and intervention and dramatically increasing federal government spending and debt. Louisianians are also connecting the dots. They see a bigger picture, which really concerns them. And Louisianians have been connecting the dots to a government takeover of banks and insurance companies and car companies, with the CEO of GM literally being fired and hired in the Oval Office, and now potentially 1/6 of the U.S. economy through health care. So there is a broader concern and theme that I've heard over and over, which is an explosion of federal government power and intervention and an explosion of federal government spending and debt. This bill, unfortunately, does nothing except to confirm my constituents' worst fears in that regard. It's more of the same. It's more of that theme. It's another big dot that they'll be connecting in that trend, and I share that concern. One specific issue that goes to that concern, Madam President, is the so-called government option or public option, because that strikes a lot of people, including me, as a big open door to dramatically increasing the federal government role and dominance in health care in our country, 1/6 of our economy. Now, why do I say that? Well, I truly believe the government option, if this bill passed or anything like it passed, would be the dominant option overnight and perhaps the only option in a few years. Let me explain why, and I'll just point to one provision, which is the so-called pay-or-play mandate on business. Under this Senator Reid bill, as under previous versions of this idea, like the Senate Health Committee bill, a business, virtually any business in the country, would for the first time have a legal mandate, and the mandate would be to provide health insurance up to a certain minimum defined by federal bureaucrats, or the business would have a choice. The choice would be, if you don't want to provide that health insurance, well, you can just write a penalty or fee check to the government instead. Now, what's wrong with that? Well, the penalty or fee check in this bill is pretty much set at $750 per employee per year. How does that equate into a business's bottom line and the choice business would face? Well, businesses that do provide health insurance nationally pay an average of not $750 per employee per year, but $6,100 per employee per year. So what sort of choice do you think that's going to present to business, and what sort of result would you expect? In this brave new world, if the bill passes, everyone is guaranteed coverage in some form or fashion, and business has a choice: $6,100 per employee per year or $750 per employee per year. I think for a lot of small business, Madam President, under extreme competitive pressure, that's not going to be a hard choice. It's going to be an easy choice. And the result for tens of millions of Americans who have coverage now that they're reasonably satisfied with through their employer, the result is going to be getting dumped off. I approach this bill looking at it carefully over the last few days. My first Bottom line question is, how does it respond to those dominant concerns that I've heard over and over again among Louisiana citizens all across the state over the last several months? What does it do about ballooning federal spending and debt? What does it do about the growth of government power and intervention and the cost of health care? Sadly, Madam President, it fails on all those accounts. It moves us in the wrong direction on all those accounts. And so I urge my colleagues to adopt a different approach, to vote no tonight, to not move to this approach, to adopt a far more focused, positive approach that respond directly to those concerns of the American